Hi, Linda. So thank you for taking the time to fill out our 3-item scale that we're using to better assess your chronic pain and understand it. So if it's okay with you, I'd like to go over your answers, and I have some additional questions for you as we start to look at creating your future treatment goals. Would that be okay?
Sure. But does this mean you're going to take away my pain pills?
The goal is not to take away your pain pills, but we do need to assess what benefits you're receiving from them, along with the risks and side effects. We do this with all treatment modalities. The first question, what number best describes your pain on average in the last week, right? And 0 is no pain and 10 is being the pain as bad as you can imagine. So I'm looking at your score and you answered 8. Is that correct?
Mm-hmm.
Wow, okay, so you're not getting that much pain relief, really, if you're scoring that high at an 8 and you're taking what we consider a fairly high dose. Mm-hmm. So let's move on to your next question, which kind of goes into this. What number best describes how, during the past week, pain has interfered with your enjoyment of life? You answered 8 to this question, is that correct?
Mm-hmm.
So out of curiosity, what brings you joy? What do you enjoy about life?
Well, I used to really enjoy being outdoors, like hiking or fishing or gardening. And, now I'm just taking my pills in the morning and napping on the couch all day.
That kind of brings us to the last question I want to ask you about. What number best describes how, during the past week, pain has interfered with your general activity? So again, you answered fairly high, a 7. So I'm curious for you, general activity, what's that mean for you?
So it's cleaning the house, cooking, doing errands.
I'm confident that you're actually going to feel better, that your function's going to increase, your quality of life's going to increase, and your pain is actually going to decrease as we do these. So what I'd like to do at the end of our visit is talk about some of these other treatment modalities with you that I mentioned at the beginning, and maybe you would be able to pick 1 or even 2 to start with this month that I could refer you to. Would that be okay?
Yeah, I'm excited about that, hearing about other things that could help than just the pills. Thanks for really listening.